have segmental traction. There's no big difference between the two. The only one is if you use segmental traction, you're going to stabilize the segment below whatever one you're trying to traction. So we have different ways of doing traction. You have, you're good, relax. You have your hands, this is general traction to start. Hands under the occiput, and then your hands are just resting along the neck. And then all you're doing is putting yourself in a position to where you can lean back. And with his occiput sitting on my metacarpal area, all I have to do is just lean back, and there's a gentle pull hooking under his occiput. And then you just hang out. You can do traction where you're holding the side of the head. I personally don't like this one because I find it to be weird and tiring, but you can do it. And then you have, let's say I wanted to do traction for a sustained period of time, we'll say 5 minutes. I'll just come in, relax. You put your radius underneath the occiput, and all I'm going to be doing is pushing a little pressure down while I pronate. So I'm here, put a little pressure down, pronate, and now I could just hang out.
I like that one.
I like this one. It should just be neutral, not
Get paid to use this.
It's, yeah, neutral, yep. Good. So that's general traction. You have options. There's no, you know, we're not going to hold you, you should have to do this one or that one. It's just here's some different options. If I have TMJ pain, I'm not going to be doing this one. If I'm going to be doing it for 5 minutes, chances are I want to do that one. So it really just depends on the patient's symptoms and how long you're going to be doing it for. Segmental traction, just take one hand and stabilize the segment. So we'll say I'm going to stabilize C6. I'm going to get down onto C5 on the other one with the occiput in hand, and I'm going to try to pull the whole thing, C5 off of C6. So all we do, stabilize C6 and push down, stabilize C5. I'm not doing anything with my shoulder, I'm just using it so that I can support myself. And then while pushing my hand down and just leaning my body up for traction of C6 off of C5. So this one is not a facet glide, it's a straight lift off or distraction.
So your hands are on C5 and you're distracting there. It's
So
correct.
my left hand right now is on C6.
Right. And
Putting a little pressure down.
the one that's distracting is C5.
Yeah.
Okay.
And then I'm just leaning my butt back. And I'm just locked up in place so that I can use my whole body to lean back rather than pull with my arm.
Could you potentially do that from the occiput too, if you wanted? But I know you're doing segmental, so that specific one. But
Yep.
if you want to hit everything above it,
Then you could just do it at the occiput. So that if I want to do that, I'll just hold C5 or C6 and then just pull.
okay.
And you could do that anywhere. If I want to do it C2, I just go up to C2 and I do it at C2. It really just depends on whatever level you want to be specific.
How long are you holding?
Up to you. If you can go with, a lot of times when you get to modalities with traction, you guys look at intermittent traction. So manually, usually I do it 30 seconds to a minute, then I'd stop, take a break, to 30 seconds to a minute, stop, take a break. So that's usually the go-to. But you just have to monitor the symptoms, make sure it's not provocative, make sure it is making their symptoms reduce. And the reason we are specific rather than just general is if they have other neck stuff going on, you can't be general. Let's say that he has a problem at C5, C6, that's our concern, but he has a fusion at C2, C3, I can't just be distracting the whole thing, so I need to be more specific. So it really just depends on the situation with the person. If they have irritable ligaments, you can't be distracting through it. If you have an irritable dura, you can't be distracting through it. So you just have to make sure that you know the same symptoms that you would be irritating with your traction test, same things as to why you can't do a general traction technique.
Is there any way to do traction seated? Like, let's say she just doesn't like laying down or something? There are steps.
Sure, we can go through that, why not? It's nothing that you guys don't know already. So you know the flexion pavum technique where you stabilize the bottom one, take the top one, pull it at a 45-degree angle? So instead of pulling at a 45, go to the edge of the table. Good. So instead of pulling at a 45-degree angle, you're going to do that same technique, except just pull up. You're a tall guy. Scoot over. Try my left hand. Pick a segment, lumbrical grip, scoop the skin out of the way so that you're on the articular pillar. You're going to be on the superior segment, and then you could do neutral flexion extension if you want, but usually it's kept in neutral. Pull back and down on the bottom segment, and then just stand up. Or if it's a low grade, you could just take a deep breath. But all I'm doing is now going up towards the ceiling, which you can see there's not a lot of movement because that would not be good for his spine.